You guys have made it to the chronic headache management after craniotomy. And I get the privilege to introduce Dr. Anna Esparham. Dr. Esparham is a triple board certified physician in integrative medicine, pediatrics, and medical acupuncture. She has also received additional certificates in clinical hypnosis and aromatherapy to apply as many pediatric integrative medicine approaches to help children and families with chronic conditions. Previously at a large regional academic medical center, she built a pediatric integrative medicine and medical acupuncture clinic. She then helped launch the first of its kind pediatric headache treatment center in the country at Children's Mercy Hospital in Kansas City, using traditional and integrative therapies to treat headache pain. So we welcome Dr. Esparham.
Yeah. It's going to be a small group today, so maybe, feel free to just raise your hand and ask questions during it. That's what I always like. I always forget my questions at the very end. So, does anybody have headaches here? Yes, you, and then yes. Okay, good. Yeah, I do too. So
Yeah, me too.
yeah, we all have headaches. Well, I'm really going to speak on after surgery, epilepsy surgery specifically, and so a lot of patients who go through surgery, especially, any kind of brain surgery, is going to have a lot of headaches. But what's interesting is those kids who, even before they go to surgery, will have a high percentage of headaches anyway, and so you may not even know that. Because sometimes kids won't complain until it's like really, really bad and really debilitating. So, and typically about 86% of those who have a hemispherectomy do significantly have headaches after the surgery. So the bigger the surgery it is, the more likely the child can have headaches. And the most common type of headache is a tension type headache, and then the second most common is a migraine. And so I'm just really going to focus on those two types of headaches today, and just kind of combine them a little bit. Okay, so the biggest risk factors for persistent headaches that last a pretty long time, are any type of stress. So stress is actually the number one trigger, which we'll talk about, but also if there is a history of anxiety and depression, worry, and like I said before, if there is a very, very long surgery. And the reason for that is they're really thinking there's some kind of inflammatory reaction. Anytime you cut through soft tissue, and anytime you cut through bone, it is going to irritate all that tissue, all the muscle, all the bone, all the nerves. And sometimes we're prone to having our nerves become overactive. Like even if we hit our elbow, some of us who have a genetic predisposition to having pain will have a very, very strong pain reaction. And so that's what can happen after surgery. Also, this inflammatory reaction, it almost might be similar to like a concussion, like having a traumatic brain injury itself, and so a lot of people with concussion also have pain. The other thing too is that we're going to talk a little bit about this, is a lot of overuse of pain meds, especially opioids and barbiturates, any triptans, and a lot of NSAIDs and acetaminophen. So if you guys get that more than 10 to 15 times a month, you can actually worsen your head pain. And a lot of doctors don't know that. I did not know that until I got pain training and headache training. And so you really have to watch out for that, because a lot of kids come to us with the medication overuse headache, unfortunately. We would like to do a lot of early intervention with the headaches. So the earlier we treat the headaches, as soon as the child gets headaches, we really need to start treating right away, because when that pain cycle gets revved up, the pain cycle loves to give you more pain. It's like a positive feedback cycle. And so we really want to stop that ahead of time, because headaches are the third leading cause of disability in the world, as big as rheumatologic disease and cancer. So it is pretty disabling. And these are some of the headaches that I did talk about earlier, and they can become chronic, which means you have 15 headache days or more per month. And so that's what's typical. Usually after surgery, or usually the kids that we see in our headache clinic have chronic headaches. So there are lots of different triggers and physiology behind it. There's hormones, there's the gut-brain axis, the nutritional changes, hydration and weather changes, barometric pressure changes, stress, you name it, menstrual changes, mitochondrial dysfunction. But the top three are stress. Number one is going to be your trigger for a headache. So that can have, like, say a kid gets bullied, or a kid has a fight with a friend, then 1 to 2 days later, they could develop a migraine. It might not be right at that moment. So sometimes parents have a tough time telling whether or not the kid is stressed out because it happened a couple days before. Sleep disruption is also a big one, because if you even get an hour less of sleep, or even an hour more of sleep, then you can have worse headaches. And then weather change is a big one, and this is really up and down in terms of when you get it, but you could have it 2 days before the big storm comes, during the storm, or after the storm. So it really just depends. It's all personalized. So there's two different types of management. One is to prevent the headaches, and one is to get rid of the headache while it's going on, just right then and there. And the abortive medications, I really want to hone in on this, is there's several things that you can do, several things that you can find over the counter, and several things that you can talk to your doctor about. And so we're going to go over this today. But the big thing is not to overdo any of these medications, specifically like naproxen, ibuprofen, Motrin, Tylenol, and no opioids more than a few times a month. Opioids are like the top in terms of causing the medication overuse headache. The ones that you might want to consider, especially if the headache is going on for more than a day or two, is considering longer acting pain meds. Like naproxen is a 12-hour, it lasts for 12 hours, so you have less risk of the medication overuse headache. And it's just a little bit harsher on the stomach, so you do have to eat food and drink plenty of water with it, because it also can affect the kidneys. And then there's one that you can get prescribed by your doctor. It's called meloxicam, which is just like naproxen, but it lasts for 24 hours. And so that actually helps really, really reduce the risk of medication overuse headache. So the longer the medicine lasts, the better off you'll be in terms of that. So the oral headache cocktails, you'll typically want to do, especially if you've got nausea with it, you want to do naproxen or an ibuprofen. I love naproxen because it lasts for a long time. You have less risk of that overuse. And then compazine, which is an anti-nausea medicine, it also has anti-migraine or anti-headache effects. So you get that additional benefit from the compazine to really calm down if it's like a more migrainous type headache. And then Benadryl is typically given because it helps with nausea and it helps you fall asleep. It has no headache properties whatsoever. So you can always omit the Benadryl if you want to. Now, if there's risk of bleed, say immediately post-surgery, someone has to be on anticoagulants, you might have to stick with Tylenol and compazine, for example, because the NSAIDs will cause an increased risk of bleeding. So again, the meloxicam, the other thing I like about the meloxicam, that 24-hour NSAID that acts like the ibuprofen, but for 24 hours, if you do a 7.5 milligram dose, you have less risk of GI bleed and side effects because it doesn't cause that GI problems like the other ibuprofen and naproxen. Triptans are usually those meds that you do have to get prescribed by a doctor. And they're typically used for a migraine flare. And so it's typically given, like, you can just do a triptan by itself, but if you still have a migraine, you can actually combine the oral headache cocktail with the triptan. And you can do it for up to 3 days. Like, you could do a triptan, naproxen, compazine, that anti-nausea medicine, every 12 hours for up to 3 days. The lidocaine patch, I typically like this because after surgery, you have a lot of neck pain because there's a lot of nerves in the back. They're actually called occipital nerves in the back of the neck. And they really do get irritated after surgery. And you get a lot of neck tension, you get a lot of muscle tension. And so the lidocaine patch you can find over the counter, that's the 4% version. The 5% is a prescribed form, but you can find it over the counter as 4%. And you just slap it on the back of your neck, upper shoulder, wherever, pain can be where they're tender. And you can leave it on for up to 12 hours at a time. And that kind of takes the edge off for a lot of kids because these nerves in the back of the neck here actually cause full-on headache pain all around the head. The other thing you can do, this does have to be prescribed by a doctor, is especially if they have frontal headaches up in the front here in the forehead, you can actually get prescribed an oral lidocaine. It's a 2% viscous oral lidocaine, and the pharmacist will give you an oral syringe. And what you do is you basically put that syringe up your nose, spray hard and fast, and it gets to this little ganglion. I guess I don't have a pointer. Well, it gets to this right there. It's a big nerve bundle that actually can also, if it gets irritated, it causes headaches, and it actually calms down the pain. And you can do that up to 4 times a day. So you can always ask your doctor about that too. Topical pain creams are also beneficial, especially when there is a lot of myofascial tension and like muscle pain, neck pain, shoulder pain. You can always palpate like wherever you are and see if you do have a lot. Most people have a lot of tension in the back. Like even if you don't have headaches, a lot of people do have that. Tramiel is a homeopathic pain cream you can get over the counter. This has been studied. I think there was a randomized controlled trial for this. It works great for tension type headaches. And so you can use that. It's very safe because it's homeopathic. I am an aromatherapist, and so I make my own little combo of arnica oil, St. John's wort oil, and a lot of essential oils for pain. It's just you probably need to, can't use this on young kids, 5 years old and lower because of the high potency of essential oils. So you really need to have an aromatherapist watching out for that. I think I do have a free precautions and how to use essential oils because a lot of people don't know, and the multi-level marketing doesn't really quite get it. It's on healthispowher.com, and there's a free aromatherapy little course about precautions and things like that. If you guys are using essential oils, you just want to know about all the science behind it and how to actually use it safely. Biofreeze, like menthol-based creams, menthol always contains salicylate, which is it's like aspirin. And so you just want to avoid too much because it can cause salicylate poisoning. So feel free to use it. It's just don't overdo it. And then there's also over-the-counter capsaicin. I typically don't recommend this because if a kid puts it in their eye, it will burn their eye because it's cayenne. It's basically pepper. And so you really have to be cautious with this. So if they wipe their neck and they accidentally wipe their eyes, it's really painful. You can get a topical diclofenac pain cream. That's a prescription. That's from your doctor, and that's an NSAID. So that's like ibuprofen, but in a cream form. And so if there's a lot of neck inflammation or tension type headache inflammation, you can put it on there too. There's compounded pain creams. Those are very expensive, but they work just a little bit better than the topical diclofenac pain cream. Okay, so the neuromodulation devices are probably one of the better devices for kids because we don't want to use too many medications. And so neuromodulation devices are kind of really in use for children these days. And I am actually speaking on Neurivio's behalf today, and I do find that the Neurivio device is probably one of the better options out of the neuromodulation devices because it's a little bit more affordable and the kids like it a lot better than the GammaCore and the Cephaly, but that's just from my experience. And the Neurivio goes on the arm. So it's an armband, and it's called a remote electrical neuromodulation device. And it's FDA approved for adolescents about 12 and up. Now, this is a prescription, so you do have to talk to your doctor about it. Typically insurance will not pay for this. And so what Neurivio has done is that they'll give you the first device for $10. And then the subsequent devices are $49, and they each come with 12 treatments on it, 45 minutes each. And that is to get rid of the headache. So right when you have a migraine, you slap that on your arm, do it for 45 minutes, and it either calms down the migraine or can get rid of the headache. And so a lot of our kids like this because it really isn't painful. And a lot of the kids using the other devices sometimes talk about it's a little bit uncomfortable with the other ones. Now, this one you really can't use with super uncontrolled seizures. That's one of the contraindications is very uncontrolled seizures, pacemaker, having metal in the brain. So with different types of surgery, you just have to watch for that. These neuromodulation devices work by sending a signal to the brainstem and releasing neurochemicals that stop the pain cycle. And so it doesn't cause any medication overuse. There's really no side effects. Some people say it just kind of feels funny. It feels weird on their arm, but not a lot of side effects. And it has a feel-good effect because it releases feel-good neurochemicals. The other thing too is that Neurivio has studied this and shown that it's worked pretty well is this benefit of digital health. And they have this guided imagery, relaxation, education app video that goes along with their Neurivio. And when you combine a relaxation response with pain control, you get a way better outcome than just pain control by itself without that relaxation response. Anytime you relax the nervous system, while you're having pain, it automatically takes the pain level down a notch. That's why I teach a lot of hypnosis, meditation, guided imagery, progressive muscle relaxation. And so using that app has shown it's proven to show that it actually works pretty well for the kids. The other devices are the Cephaly and the GammaCore. And the Cephaly is not a prescription. It's a little bit more expensive. I think right now it's about $350. The GammaCore is a prescription. I think it's a lot more expensive than that. I think it's like over $200 a month, maybe $200 a month. The Cephaly stimulates these nerves up here, so it's great for forehead headaches. A lot of kids complain because it really is kind of pinchy on their forehead. So they're coming out with a different device pretty soon here. It's called Relivion, so I hope to know more about that device. It's not supposed to be as uncomfortable as the Cephaly. But some kids love it and some kids don't like it. It is FDA approved for adults. You can use it to both prevent and abort. So you use it 20 minutes a day to prevent the pain, and then 60 minutes to get rid of the pain. The GammaCore is a vagus nerve stimulator without having to implant a vagus nerve stimulator in the brain. And so you can just use that. The vagus nerve runs where the carotid artery runs. And it's great for a relaxation response because the vagus nerve is all about relaxing. It's that big, huge nerve all the way from the belly all the way up to the brain. And it's really great for headaches with anxiety. And it's just a little bit more expensive. And so I just haven't been able to prescribe it as much for patients. But you can both prevent and abort the pain. Neurivio is going to come out with the prevention here pretty soon, probably hopefully by next year. And so I'm hoping to use that more for preventing the pain instead of just getting rid of it. If you guys go to the emergency room for a migrainous type headache, they'll typically prescribe the IV compazine or Reglan, it's a similar med, Benadryl, Toradol, and fluids. IV compazine, sometimes doctors don't know how to give it, and so you can have a very, very big adverse reaction to it because it can cause agitation, anxiety, severe muscle spasm, restlessness. You want to pull out your IV. After it's all done, you don't remember what happened. It makes you go crazy, is what all my patients say. So it really has to be a slow infusion, not a push. And then if the headache is still present, you want to get some more meds, which is IV magnesium and IV valproic acid. And so that's really the standard of care in going to an emergency room. But some emergency rooms don't have a standard headache treatment. And so I've had a lot of patients come back with some significant issues. And so that's why I'm trying to educate everybody. Nerve blocks are wonderful after post-craniotomy headaches because they really get to those nerves. A nerve block is really superficial, meaning it just goes lidocaine and bupivacaine, numbing medicine, goes underneath the skin in a few areas in the back of the neck here, and it doesn't hit anything, no major tissues, and then it goes on the sides and then sometimes on the eyebrows. And it is the best treatment for chronic headaches because it can get rid of your headache or decrease it significantly for about 4 weeks. And the reason why it works so well too is because when people come to us with the chronic daily headache and they've had it for months, well, the meds, the preventive meds that we're going to talk about don't kick in for about 2 to 3 months. So we try and use this nerve block as a bridge. However, insurance companies aren't paying for it because they're like $12,000. And so we really have to fight to get these nerve blocks done for the kids. But out of my chart review that I've done, it is one of the best treatments. Out of several other studies, it is the best treatment for chronic pain around the head. And it's really simple. You don't need ultrasound, anesthesia, nothing. It's just, you barely feel anything. So it's a pretty simple procedure. So we're going to talk about prevention of migraines. So like I said, most preventive therapies or medications, supplements do take 2 to 3 months to work. Now, most of the studies done on medicines for migraines and headaches are all placebo. So nothing really works in kids when you look at the studies because chronic pain in kids, if you are there to help them out, there's a high placebo response, meaning the placebo has a benefit, even though it shouldn't have a benefit. It's because the care we put in, they think that they're going to get better, so they do get better, and that's the biology of belief. Our thoughts are so powerful. That's incredible because we're really powerful human beings, and just with the power of our own mind, we can change our own physiology of our body. And so, so it's really important to understand. If you guys didn't even take any meds, you could really use the power of your mind to stop your pain with training. I'm not going to go over all the preventive medications, but knowing that there are several different classes, there are tons of medications to try. And so, do you guys get this by chance? Do you get this handout or no?
I think there's somewhere we can go to download it.
To download it? Okay, it might be good to download this and just have it on hand, just in case for later, for when you talk to your doctor. But for today's purpose, I want to talk about a lot of things that you guys can do over the counter, things that you can advocate for yourself, empower yourself with. And so a lot of supplements are for migraine or tension type headaches, and you can just get these on Amazon, your natural food store. And so magnesium is a big one because most people are deficient in magnesium, and magnesium is ubiquitous. It's in all kinds of reactions, and it also fights a pain substance in the brain. And so when we're low in it, we can actually have more pain reacting chemicals in our brain. And so that's why magnesium probably works over time. Now, you want to find the formulations that are typically not oxide or citrate, because oxide and citrate are more for constipation. So they really, just stay in the gut, and then you get diarrhea from it, looser stools. So magnesium glycinate or other forms of magnesium are a little bit better absorbed because it's really tough to absorb magnesium. And so when you're over 40 kilograms, so like, say 100-pound kid, do 500 milligrams a day. And then if you're under 40 kilograms, all you have to do is just Google how to calculate like 10 milligrams per kilogram. It's pretty easy, and it will show you what dose to take in terms of magnesium. The biggest thing for the side effect is if a kid has chronic kidney disease, you do have to talk to their kidney doctor because it can affect the kidneys, and then watch out for loose stools. So you might have to titrate down if the child has loose stools. Vitamin B2, which is riboflavin, is another supplement that is pretty benign in terms of it doesn't cause any side effects except very bright yellow urine or orange urine. And it's a cofactor in the mitochondria, and also it helps like stabilize cells. And Older children and adolescents, they need to take very high doses, so 400 milligrams, and take it daily for about 3 months for it to kick in. And then elementary age children, probably about 200 milligrams a day. And they're going to be peeing very bright yellow urine.
Not in the pediatric population, but it also causes bright yellow breast milk. I would just like to
Oh,
put
it
that
does. Watch out for that, moms. Oh, that's a good one. Okay.
Just so you know, it was very shocking.
Don't freak out.
A little bit of a pattern to change it.
Yellow breast milk. Okay.
Like, no.
That is funny. I hadn't heard of that before.
Yeah, my sister told me it was like on her migraine cocktail.
Oh.
I just started taking it, and I peed, and it was
Comes out all
yellow.
of
And then
the.
I pumped the next day, and I was like, oh my god.
What is going on?
TMI, I'm sorry, but
Yeah, no. Hey, gotta know so you don't freak out. Okay, so CoQ10, it's another, you guys can find this as gummies, liquid soft gels. If you have Costco or, what's the other one? Sam's Club. Yeah, that's it. 200 milligrams a day. Typically, you can divide it into 2 doses, but kids or adolescents do not like taking meds or supplements, so I always just give it to them in the morning because it gives them a little boost of energy, and it's also a cofactor in the mitochondria, and so there's a big mitochondria thing in headache and pain. And so don't give it at night because it can give them a little burst of energy, so it could cause insomnia. So closer to the morning with breakfast. Everything needs to be given with food. Melatonin is another up-and-coming supplement that's being studied to prevent pain or decrease pain. And actually, it's being studied as an abortive, too, so to get rid of pain. It's really typically 3 milligrams and above, up to 10 milligrams at night, no more than 10 milligrams. And people will start off at 3 milligrams, maybe a month later. You know, if kids are using it to also fall asleep, it might not work as well, so they can bump up to 5 milligrams. And then a few months later, they can bump up to 7, 9 milligrams, and so on and so forth. Just to 10 milligrams, that's the max. It's very anti-inflammatory. It actually mimics an NSAID. It mimics one called indomethacin, and it also almost acts like one of those antiemetics that I was talking about, the anti-nausea pills that also act like anti-migraine. It has a mechanism in it that acts just like that as well. However, watch out for young kids because it can give them nighttime urination. It makes them go pee more in the night, and if you don't titrate slowly enough, you can get more drowsy and sleepy during the day. So you kind of have to titrate pretty slowly because of that. Butterbur, some people have that on like the websites and things like that. It had been studied, it was great. It's just, Butterbur has these alkaloids in it that can cause liver failure. And so because of the supplements are not regulated, we just don't recommend it at this time, even though it does work, just for fear of what could be in it that really could cause liver failure in a child. The other thing too is that a lot of kids nowadays that I'm treating have iron deficiency, and it's not seen on the hemoglobin, so they're not anemic. So they're totally fine. So you do have to check their iron storage, which is ferritin. You do have to check an iron panel, and you got to check the blood counts. And so the iron storage, which is ferritin, has to be between 50 to 70, the optimal level. Anything below that, and it's normal. So anything below 50, so from 13 to 50 is normal. So your doctor might be like, oh, it's normal, it's fine. Well, it's not if you have headaches or sleep issues. And so if a kid has morning headaches, poor sleep, restless leg, periodic leg movements, it is likely they could have low iron, and we have to supplement in order to make sure their headaches are not being triggered by the low iron. And iron causes constipation and stomach aches, so we typically have to go pretty slow. So it takes forever to get those iron levels back up, the ferritin specifically. Vitamin D3 has been shown if everyone is low, even adults. If you do not take vitamin D from the winter time through February, everyone is low by February, if not supplemented, even if you eat fortified vitamin D foods. So what I usually recommend is everyone from October through March or April, just start supplementing with vitamin D. Not during the summer because you're going to get sunlight and things like that. So elementary age school children, I'll do 2,000 units a day, typically winter specific, or I'll do about 3 months if deficient. And then older children, I'll do about 4,000 to 5,000 units a day through the winter time specifically. And it does everything. I mean, regulates inflammation, immune system, neurotransmitters. I mean, it's like magnesium. Omega-3s, kids have a hard time tolerating the omega-3s because they have like fishy burps afterward. And usually you have to take pretty high doses, like 3 to 4 grams daily. And it reduces the headache up to 30 to 40%. But be cautious because it also increases bleeding time. So a kid can't be on this if they're anticoagulated, if they have a risk of bleed during surgery. So you can't really do anything around the surgery with omega-3s. It would be much later. So here are some of the therapies that we typically do in our clinic. And they work very, very well. So we do a lot of acupuncture, and kids love acupuncture. I had no idea that they would love acupuncture. And so the Cochrane reviews are the top-notch systematic reviews in the United States, and they demonstrated it is much more beneficial than medications to prevent, yeah. So we typically do 6 weekly sessions, and then if a child responds, we'll do every 2 weeks to every 4 weeks and wean them off slowly. And it really stops the pain cycle in all different types of mechanisms. And we're seeing a lot of good results from acupuncture. We have a wait list for acupuncture. All my patients, I do mostly procedures when I'm in person, and most all my patients are acupuncture. They love it. And that's what we showed here in our research. When we surveyed patients and parents, most everyone wanted to try acupuncture. So contrary to the needle phobia, it's very, very tiny. They're like cat whisker size. So, okay. So this is where I was talking about the power of the mind. And biofeedback and hypnosis are pretty much really, really well studied in the headache population. And it's really about using your own, basically feeling empowered enough, having more power over the pain, and being aware of those signals, what causes the pain, like stress, and we start tensing up, and allowing our own mind to change the way we feel about the pain. So biofeedback, a kid will be all hooked up to temperature sensors, sweat sensors, heart rate, respiratory rate, and the therapist will be like, okay, try and like think of a stressful time, and all of a sudden their heart rate goes up, their respiratory rate goes up, they're starting to sweat, they get a lot of muscle tension, and they can see that on the computer, and so it's like, oh wow, that's what stress does to me, and so it gives them a really good feedback, that biofeedback. Now hypnosis is not the pendulum swinging where we're hypnotizing someone. That actually is not true. Hypnosis is basically a different form of meditation. And so the child is using their own creative imagination to really facilitate this connection with their mind and body to be able to control or release the pain, anxiety, stress themselves. So it's pretty cool. And so there's all these pain pathways that are on the same basically anatomical pathways as the emotional pathways. So you really can't separate the two, the emotions and the pain. And so that's what I try and tell everyone is like, really, if we'll have more power over the pain just because of that reason.
Do you find that it's effective for children who are cognitively impaired?
Biofeedback or hypnosis?
I mean, either one.
Biofeedback might be a little bit tougher, but hypnosis, not so, especially if they have the capacity to daydream. Yeah, it's a little bit, it depends on how cognitively impaired you're talking about,
Okay.
but most kids who have even just a little bit of cognitive impairment, they can daydream, they can imagine. It's just their natural ability because they're finding it might be more unconscious. It might be more in consciousness than in the actual brain function. So I would probably say hypnosis is probably more of the way to go with that. So biofeedback works, but it's hard. It's a little bit harder than hypnosis because it's more at private practices and academic centers, and so there's not as many biofeedback clinics. Hypnosis, you guys can learn on your own, actually. There's a website called imagineaction.stanford.edu, and it's from the Meg Pain Foundation, and it's geared toward kids, and you know, some of my kids like it. In-person hypnosis or telehealth hypnosis is a little bit better, so you can find someone who can teach you hypnosis. It's better, and then they can just learn on their own. The kids practice it on their own. They just do it 10 minutes a day, 5 to 10 minutes a day, and they do it on their own. I have a few kids who love it and a few kids who just don't want to do any self-care whatsoever. So it just depends. If the kid is more interested in like fantasy and imagination, they're probably more apt to try the hypnosis. So nutritional therapies are a huge one. We're trying to study nutrition and headaches because the gut and the brain are so connected. There's a bidirectional highway between the gut and the brain. And so, like I said, the strong evidence is for higher omega-3s to omega-6s, because we get a lot of omega-6s like soybean oil and canola oil in our diet too much, and we don't get enough omega-3, and omega-3 is very anti-inflammatory. And so they're trying to push that. Avoiding meal skipping because of the lows and highs of the blood sugar can affect the headaches. Eating whole foods and avoiding like high processed, sugary refined foods because they're inflammatory. So we want to avoid the inflammation as much as possible. Maintaining hydration, drinking a ton of water, making sure the kid is eating plenty of good salt like sea salt or Himalayan salt. I'm finding a lot of people salt restrict, which we need salt to actually run our electricity in our body. And then obesity has been found to be associated with more pain. So we try and get everyone to a healthier body weight and then reduce a ton of caffeine. So, because it's kind of like, caffeine is kind of like a medication overuse headache, where if you get too much caffeine, then it can induce more headaches. And it also tightens up the muscles as well if you get too much caffeine. So we're going to talk about complementary therapies, massage, physical therapy, exercise, osteopathic manipulative medicine, which is usually done by a DO or osteopathic physician. Massage is benefit if there's more like muscle tension in the back of the neck, and so it's been shown to help, but not by itself. And then it does help decrease the pain intensity and frequency, but they were kind of small studies for massage. But a lot of our kids do well with massage. It's great. Anytime you're rubbing, like say you hit your elbow, when you rub it, it calms down the pain. Well, it's called the gate theory. It actually, when you're really rubbing and pushing on your elbow, it's actually sending a signal to your spinal cord in the brain where it's shutting down the pain to get through, so you don't feel the pain. So that's why also massage can work pretty well, because it's a form of desensitization. So massage, acupressure, things like that can really help. Physical therapy is great because there's a lot of biomechanics, especially after surgery. The biomechanics of the neck and the shoulder kind of get thrown out of place a little bit. And so physical therapy helps bring that mobilization back into healthy biomechanics. And so it definitely doesn't work by itself by any means, but we do a lot of physical therapy for our patients. Exercises might be a little bit more difficult, especially for kids who've had the surgery, but just getting general movement. It doesn't have to be, pretty intense, but it's just making sure the body is moving, because it produces so many healthy factors in the brain that actually fight the pain response. And then osteopathic manipulative medicine is a form practiced by DOs. MDs can do it too, but DOs actually get the training. MDs have to go and get the training on their own. DOs actually learn in their medical school. And it's just some nice, you don't want to do the high velocity neck cracking, or definitely not, because you got to worry about the arteries there. But just very light, gentle pressure and changes to the neck and the upper back are typically very helpful to treat the headaches. And then aromatherapy, lavender essential oil aromatherapy by diffuser decreases head pain by about 3 points. on the pain scale. Peppermint and sweet orange are used, and sweet orange can be used for younger children in a 0.5 to 1% dilution, but peppermint you can't use for ages 5 and younger. And peppermint's really great for nausea. So a lot of kids experience nausea when they have a lot of pain. There's a lot of our, we have some open access articles there for parents if they wanted to read more about some of these therapies too. But I think that's most of my presentation. Yeah. Okay, any questions? Yeah, it's kind of a lot of info.
Yeah.
Jam-packed.
I know for, my son takes some of the supplements.
Yeah.
Already. I guess, how many can you pile on?
Well, there is some that do combinations of like the magnesium, riboflavin, CoQ10 all together. Is there like a G tube or no? They can swallow the pills. Just and
I never thought he could.
And he can.
And we gave him
And he was
10
fine.
capsule, and he was like,
Yeah. You could do. Like typically you want to do, like if you're going to combine a lot of the supplements, you want to do the riboflavin and the CoQ10 in the morning with breakfast. Magnesium at night because it also helps calm anxiety. And then melatonin at night, obviously. And then vitamin D and omega-3, they are fat soluble, so you want to eat those with a pretty hefty meal. And so you can kind of, if you can, space them out. Like a lot of my teenagers, they cannot space them out because they're at school all day long. But it would be typically like riboflavin, CoQ10 in the morning with breakfast, vitamin D, omega-3 with a big lunch, and then magnesium and melatonin after dinner. So, yes, they can do all that.
okay.
Do you have any suggestions or guidance on, for those of us parents who are struggling to determine when the kids are really having headaches? Just like trouble with expressing exactly what it is without me giving them the idea.
Yes. Yes, I do know what you're saying, and it is tough because a lot of kids will like go for years having headaches and not tell their parents. And so typically what I do, which is kind of strange, is try and teach them more about how they feel. And so there is this emotional spiral on like feelings for kids, and so it's trying to get them more in tune with their feelings and their body. And so it's a lot of mind-body therapies, a lot of understanding their emotions, which they can obviously work with a play therapist or something like that to understand their emotions. But there's a lot of books on it where the kids can actually look at this emotional spiral or their feelings spiral and really pinpoint what's going on, what they're feeling right now in their body, and visualize that. So it's going to be more visual for them. That's what I find is a little bit easier for them, and then really getting in touch with their body using the mind-body connection. So the progressive muscle relaxation. Learning that technique is really good to feel what's going on. Like start tensing your head really, really tight and your neck, tense up your eyes, and then have them relax it as much as possible, melt like butter, and then tense up their shoulders and as tense as they possibly can get it, and also say, how does that feel to you? Is that painful? Is that hurt? Is that uncomfortable? And then allow them to relax it, melt like butter, just completely, let gravity hold it. And then tense their hands and really try and get them to understand, really connect with their body, because sometimes there's a mind-body disconnect too. So it's getting in touch with the feelings, it's getting in touch with the sensations of the body.
With the idea that they'll be better able to express what actually hurts.
Yep. So,
What was the name of that website that you talked about for hypnosis?
Imagine Action without the E. So IMAGIN action.stanford.edu, and it teaches kids that like imagination, visualization, because kids have that power already. Like you can really tap into it. especially the younger kids. So the play fantasy, they're really into the play, and they can imagine, different, like playing store and being a firefighter. I mean, they can imagine all that stuff, and so it's really quite powerful for the young kids, especially for pain, stress, anxiety, sleep issues, abdominal pain, gut pain, like irritable bowel syndrome. That's been studied pretty well. Yeah. Oh, nighttime urination. That's been studied actually with hypnosis. So yeah. And it's like hypnosis is like it's like getting the kid, okay, what's their favorite place in the whole world? And so you get them to just imagine, like, in a book, they could have read a cool place in their book, like they want to go to, whatever, Water World, or, or they like the beach or the mountains, and that's really cool, or a favorite water slide or something. And you just have them go to that place, and they hear the sounds, they sense the temperature, they smell the aromas, they really get connected to that visual place in their head, and then you can give them cues to be like, okay, where is this discomfort? Where is it in your body? I know you've been feeling a lot of head pain, or you're feeling a lot of stomach pain. Go and find it. What does it look like? And so you kind of give them prompts, and so then they're like, oh yeah, it looks like a big black sticky substance in my gut or in my head. And you're like, okay, well, you're like, are you a superhero? You can be like, you're a superhero. You have more power than this pain, and you can pull that out. And they're like, okay, yeah, I've got humongous sticky hands, and I pull out the pain. And then you can have them put it into a jar, or they love soccer, or they love volleyball, whatever. They can just put it into something, and they can chuck it across the universe where it disappears. They can bury it underneath the ocean. They can explode it with a bomb, stuff like that. And so these visual, like, even though they're imagining this, it changes their pathways. I mean, it really does change the physiology and biochemistry of their brain, their spinal cord, and their body. So for adults, if you've read The Biology of Belief, Molecules of Emotions, kind of a heavy book, it's all based on your thoughts really affect how you feel, your body. Even if, like, patients have cancer, for example, using this positive, like, manifestation thought technique or hypnosis really helps diminish cancer cells, for example. So yeah. Well, thank you guys.
Thank you.
Okay. Have a good rest of your weekend.